So in IC-MPGN and C3G, there is a big unmet medical need. A lot of patients are being diagnosed very late, if they're being diagnosed at all, and they're not receiving an optimal treatment. And this is something that we want to change with CompCure. We want to make sure that the patients are getting optimally treated so that they can live fulfilling and healthy lives.
So we are talking about children and adults with a very rare disease, okay? And if these patients are almost alone in the clinic, or when we see all the patients in all Europe, we find there are many patients. And this gathering some blood sample and urine from them can help us to study this blood and urine and understand better if there is something in common, to find new markers and find new opportunities to understand better the disease and find new treatments. You know, this is all what we have, the urine and the blood, and here you see there is no urine. It's good.
This is very important because we want to know more about these diseases than we would routinely document on any kind of kidney disease. So here we really are interested in how do the patients present, what is their kidney function over time, how does the kidney disease respond to the treatment with various immunosuppressive drugs that are available, and what is the long-term outcome. And we are also interested in how the patients are doing, how they are feeling, how they are coping with the disease. And all this is connected in the CompCure registry.
When the patient is coming to us, we ask for actually if he wants to participate in the registry, okay, and in the biobanking. The patient has to sign a consent form, okay, where he's saying that they agree in participating in this project.
Only if a patient is enrolled in a registry, we can collect data on his disease, on his case, in a systematic fashion. Of course, every physician also takes notes, and we have the hospital system, but each hospital system is different, and we cannot compare the notes of the treating doctors in different hospitals very easily, because the way they write up things differs. And so we need what we call structured information. We need to follow certain pieces of information in the same way across all hospitals in Europe to be able to compare the cases. And that's why we need as many patients as possible to be enrolled in this registry, to have a powerful database that we can then use for deciding the therapies and finding out what the causes and consequences of the diseases are.
So once we obtain the blood from the patient, we had to centrifugate, okay, so to divide the cells from the serum.
We have established a very strong steering committee of leading experts in the field of complement-mediated kidney diseases. They're going to review all the data from these patients. The tests that we are going to do will be done by the state-of-the-art labs in Europe, the very best labs in Europe. And what patients will then immediately get out of CompCure is a strong assessment of their disease state. In the longer run, we are going to develop guidelines that will allow these patients to be treated optimally, and hopefully we can also discover some new biomarkers. I have been through a difficult journey myself with my daughter. She has IC-MPGN. She was treated by very good hospitals in different countries, but it was very difficult for the very skilled nephrologists who took care of her to actually treat her and to figure out what was wrong with her.
Du så viele Medikamente nehmen.
Ja,
you talk a little more in this field?
My motivation for founding CompCure was to secure that more patients are being diagnosed and more patients will receive an optimal therapy.
So if we have new therapies, if we have new biomarkers, and if we have really good information, then I think we have done a good job.